Motion to open Generation Math Board meeting number 008. Healthcare costs multiplied 4.7 times. Same procedures, same care, different generations.
Hold up, 4.7 times? For the same exact healthcare?
Correct. 1980 average family healthcare spending, $3,000 annually. 2024, $14,100. Bureau of Labor Statistics Consumer Expenditure Survey 2024. Filed.
We paid our premiums and got coverage. Simple system.
Bro, we pay 4.7 times more for the same appendectomy. Make it make sense.
Motion to examine the mathematics. Healthcare inflation outpaced wages 2.3 times faster than general inflation. CMS National Health Expenditure Data 2023.
Wait, so it's not just normal inflation?
Negative. General inflation multiplied prices 3.8 times since 1980. Healthcare multiplied 4.7 times. Wages only multiplied 3.2 times. The gap compounds annually.
We had simpler healthcare back then. No MRIs, no advanced treatments.
Same broken arm costs 4.7 times more. Same birth delivery costs 4.7 times more. Technology didn't multiply bones.
So what changed between 1980 and 2024?
3 structural shifts. First, administrative bloat.
Healthcare needed proper management systems.
Administrative costs rose from 3% to 8% of total spending. Duke University Study 2023. We're paying billions for paperwork.
Confirmed. For every doctor, there are now 10 administrative staff. 1975 ratio was 1 to 3. Health Affairs Journal 2024.
Hold up, 10 administrators per doctor?
Complex insurance requires complex processing.
Complex excuse for simple theft. Same X-ray, 4.7 times the price.
Second shift, employer coverage collapse.
In 1980, 89% of full-time workers got employer health coverage. We earned it through loyalty.
Today it's 54%. Kaiser Family Foundation 2024. And that coverage costs more for less.
Wait, fewer people covered and it costs more?
Affirmative. Average employer premium in 1980, $800 annually. Today, $8,435. That's 10.5 times increase while coverage dropped 35 percentage points.
Companies can't afford to cover everyone anymore.
Companies posted record profits while cutting coverage. S&P 500 margins doubled since 1980.
Third shift, the deductible trap.
I'm scared to ask.
We had $200 deductibles, reasonable cost sharing.
Our average deductible is $1,650. Commonwealth Fund 2024. That's 8.2 times higher.
Motion to examine real scenarios. Appendectomy 1980, $1,500 total cost. Patient pays $200 deductible plus 20% co-insurance. Total, $460.
And today?
Appendectomy 2024, $35,000 total cost. Patient pays $1,650 deductible plus 20% up to out-of-pocket max total, $7,650.
From $460 to $7,650. That's 16.6 times more out of pocket.
Medical technology advanced significantly. CAT scans, robotic surgery, precision medicine.
Same appendix removal, same recovery time, 16.6 times the bill.
But don't Gen Z people use less healthcare?
Correct observation. Gen Z visits doctors 40% less than boomers did at the same age. Deloitte Health Consumer Survey 2024.
Because they're younger and healthier.
Because we can't afford it. 45% of Gen Z skipped necessary care due to cost. Same survey.
The mathematics compound. Healthcare inflation 4.7x. Wage growth 3.2x. Coverage drops 35%. Deductibles up 8.2x.
So what's the actual annual burden?
Boomer at age 25 in 1980. $3,000 healthcare costs on $18,000 median income. That's 16.7% of income. $14,100 healthcare costs on $38,000 median income. That's 37.1% of income.
We didn't have health savings accounts or flexible spending.
HSA max contribution is $4,150. That covers 29% of annual costs. Math ain't matting.
Wait, even maxing out tax-advantaged accounts doesn't cover it?
Negative. And that assumes Gen Z can afford to save $4,150 annually while paying student loans averaging $393 monthly. Federal Reserve SCF 2023.
Healthcare quality improved dramatically. Cancer survival rates, heart surgery success, diabetes management.
Life expectancy peaked in 2014 and declined. We pay 4.7 times more for shorter lives.
CDC data confirms. U.S. life expectancy 2014, 78.9 years. 2024, 76.4 years. Only developed nation with declining expectancy.
We pay more and live less?
That's lifestyle choices, not healthcare quality.
It's bankruptcy choices. Medical debt is the #1 cause of personal bankruptcy. 530,000 families annually. American Journal of Public Health 2024.
Motion to examine prevention economics.
Annual checkup 1980, $50. Affordable prevention.
Annual checkup 2024, $400 before insurance. After insurance with high deductible, still $400.
Insurance doesn't cover basic checkups?
Only after meeting deductible on most plans. 67% of Gen Z has high deductible plans. KFF 2024.
High deductible plans offer lower premiums. It's a choice.
It's the only choice. Traditional plans cost $18,000 annually. That's 47% of median Gen Z income.
The compound effect. Skip prevention due to cost. Develop chronic conditions. Face catastrophic bills. Declare bankruptcy.
That's a death spiral.
We had our health challenges too. No one helped us.
You paid $460 for surgery. We pay $7,650. Same surgery, that's the help difference.
Motion to note employer contribution changes. 1980, employers paid 100% of premiums for 45% of workers. 2024, employers pay 100% for 5% of workers. BLS Benefits Survey 2024.
From 45% to 5%?
Healthcare became too expensive for full coverage.
Healthcare became too profitable to keep affordable.
Insurance company profits 1980, $3.5 billion industry-wide. 2024, $47.8 billion. Fortune 500 data.
13.6 times profit growth while coverage shrank. Numbers don't lie, generations do.
Insurance companies take risks and manage care.
They deny 18% of claims, up from 5% in 1980. AMA Patient Survey 2024.
So we pay more, get covered less, and get denied more?
Affirmative. The triple squeeze documented.
Look, we acknowledge healthcare costs rose faster than ideal.
4.7 times faster, while wages grew 3.2 times. That gap is $4,900 annually.
Motion to calculate lifetime impact.
This won't be pretty.
Boomer lifetime healthcare spending, inflation adjusted, $284,000. Milliman Medical Index 2024. Gen Z projected lifetime healthcare spending, $1,387,000.
That's projection, not guaranteed.
Based on current 5.4% annual healthcare inflation. CMS Office of the Actuary 2024.
The difference, $1,103,000 per lifetime. Filed.
Over $1 million difference for the same human body?
Medical advances justify some increase. We didn't have robotic surgery or immunotherapy.
We're not talking about advanced care. Insulin was $20 in 1980. Now it's $300. Same exact formula.
Confirmed. Insulin discovered 1921. No formula change. Price multiplied 15 times.
Wait, 100-year-old medicine costs 15 times more?
Drug development requires research investment.
Insulin research was completed in 1921. We're paying for yacht research now.
Motion to address practical solutions.
Young people should prioritize health insurance in their budgets.
Health insurance is 37% of our income. Rent is 35%. That's 72% before food.
So 72% of income just for shelter and healthcare?
Confirmed. Versus 42% combined for boomers at equivalent age. Census Bureau 2024.
Then work multiple jobs like we did.
Multiple part-time jobs don't provide health insurance. That's the gig economy trap.
36% of Gen Z works gig economy jobs. 0% receive employer health benefits. Pew Research 2024.
So working more jobs means less healthcare access?
Purchase individual coverage through the marketplace.
Average marketplace plan, $456 monthly with $7,000 deductible. That's $12,472 before insurance pays anything.
Mathematics verified. Healthcare.gov 2024 data.
A third of median income before insurance even kicks in?
Correct. The affordability threshold crossed.
Our generation built the healthcare system that leads the world.
Leads the world in bankruptcies, dead last in outcomes among developed nations. In 2024,
US ranks 46th in life expectancy, first in per capita spending. The inverse correlation documented.
We pay the most to live the least?
That's oversimplifying complex factors.
It's math. Highest price, lowest outcome. Simple equation.
Motion for final assessment.
Wait, what can someone actually do about this?
3 actionable steps. First, maximize HSA if available. $4,150 annual limit, triple tax advantage. Negotiate every medical bill. Average reduction 27% when contested. Medical Billing Advocates of America 2024. Use GoodRx or similar for prescriptions. Average savings 79% versus insurance price.
Those are band-aids on a systemic problem.
Your generation created the systemic problem. We're stuck with band-aids.
The mathematics stand. Healthcare 4.7 times more expensive. Wages 3.2 times higher. Coverage 35% lower. Deductibles 8.2 times higher.
So who wins this debate?
The insurance companies. $47.8 billion in profits. Both generations lose.
We paid into the system our whole careers.
We'll pay 4.7 times more into the same broken system.
Motion to close. Healthcare inflation outpaced wage growth 2.3 times. This gap widens 5.4% annually.
Will it ever get better?
At current trajectory, Gen Alpha will pay 11.2 times more than boomers. Mathematical certainty and less structural reform.
Each generation faces its challenges.
Our challenge is your generation's profits.
Final verdict. The generational healthcare gap is mathematical fact. 4.7x multiplier. 2.3x faster than wages. $1.1 million lifetime difference.
That's the kind of math that starts revolutions.
The revolution is already priced in. Insurance stocks up 400% since 2010.
We're not patients anymore. We're profit centers.
The system works if you work the system.
The system works you until you're worked out.
Generation Math Board meeting 008 closed. The numbers are filed. The gap is documented.
So what's the question for viewers?
Simple. Can you afford to get sick? Boomer or Gen Z? Vote in the comments.